Welcome back to the Dr. Greg Jones Optimization Academy. And today we're going to tackle one of the most misunderstood areas in regenerative medicine, stem cell therapy. Most people have heard of stem cells when it comes to healing injuries, perhaps healing from a traumatic brain injury or treating an autoimmune condition or even handling chronic pain. But what is the truth behind stem cells and what is a good stem cell? So to help us unpack it, my guest today is Eric Stoffer, CEO and founder of BioAccelerator in Medellin, Colombia. At BioAccelerator, Eric and his team are pioneering cutting-edge therapies to address spinal cord injuries and TBIs and orthopedic injuries and joint injuries, treating everyone from athletes to celebrities to just someone looking to optimize their health and heal better. BioAccelerator's mission is to focus on health span, not just lifespan. So in today's episode, we're going to explore the science behind stem cells, the difference between stem cells that are claiming to heal and help people here in the US versus what's available offshore, and also why Eric believes regenerative medicine is not the future, it's the present, and it's here today. So whether you're a provider looking to learn more about stem cell, a potential patient trying to figure out if stem cells and regenerative medicine are for you, this episode is packed with insights and information that you don't want to miss. Let's get to it. Hey, man, welcome to the show.
Dr. Jones, it's always a pleasure to see you, but it's a pleasure to be in front of your audience also.
You know, it's not as nice as being in Medellin, hanging with you, but I will take it. We'll take it. You know, the weather's cooling off here in Arizona, and so that's really good.
That's why I'm back.
Yeah, exactly. It's time. You dodged it the whole time. Now you're here, and that's really good. So, speaking of Medellin, that's where I met you, down at BioAccelerator. Went down there, and I'm going to tell you, man, I was extremely skeptical because obviously you think like, okay, Colombia, it's like stem cells, what are we getting into here? What's this going to be? And you walk in there and it is one of the most amazing facilities I've ever seen. I was like, holy crap. I have the junkyard clinic here. I have the behind the scenes, but my stuff is not this nice.
No, yours is beautiful.
Oh, thank you. I appreciate it, man. But yeah, it was a beautiful experience, and then meeting the staff and meeting the physicians down there and the research staff, and everyone was kind, and not just kind, they were knowledgeable, right? They understood the process here. So, but that's kind of where you are now. But how'd you get there? Because you didn't start in medical. You didn't start in this world. You actually, from my understanding, you're an entrepreneur and you started in the restaurant industry.
Yeah, I mean, that was really my first job, but then I took a long part of the first part of my career in the restaurant business. Yeah. But before I get into that, I've got to commend you also because, you coming to Medellin is a testament to who you are as a physician because, our healthcare practitioner program that we solicit relationships with people all over the world, mostly focused here in the United States. We get a mixed bag of reactions. It always starts with the exact same thing that you just said. Right. I'm kind of skeptical, and you think that Colombia is a third world country, and you remember about the danger that you heard about on Netflix with Narcos, which, by the way, it was true.
Yeah.
But now it's this vibrant, beautiful city that has this amazing medical infrastructure, which is part of the reason that I ended up choosing it. Yeah. But it takes a different, more progressive way of thinking to actually go and take part of this educational process. So thank you for that.
No. I mean, they were like, hey, we'll fly you to Colombia. First of all, I wanted to go to Colombia. And I was like, okay, and I got to see this facility. So I was like, let's kill two birds with one stone. But you're right. You get down there and you're like, this is actually great.
Yeah.
And I think that, now you guys, you have the video, you guys are doing more, like you can see what things look like even before you go there and things like that. So I just kind of went into it with an open mind and it was great. But, coming from, you might as well be on Mars and Jupiter coming from the restaurant industry to BioAccelerator. So what led you into this space and its BioAccelerator?
Yeah, cool. So, I mean, the first job I had was as a busboy in the restaurant, and then I worked my way through university and, every position within the restaurant. And then I ended up managing and GM and, some small ownership in restaurants. And I got out of that to go into real estate. So my transition was actually from being the CEO of a real estate company into BioAccelerator. Right. But a big bulk of my career was in the restaurant business. And there's good and bad that I can can extrapolate from that. One of the good that relates to what we do at BioAccelerator is the hospitality aspect. We're a medical tourism provider, and we also provide somewhat of an experience for our patients. And I think some of the hospitality aspect of the early part of my career translates into that. That and managing thousands and thousands and thousands of people over the span of, a decade in the restaurant business. But my transition was actually from real estate. So how did I start BioAccelerator? I was the CEO of a real estate company here in Arizona. We were a real estate investment trust with single family homes, but we just happened to be selling this major, it was a resort property in Cabo San Lucas, and it was a very rundown resort. And we were getting these really bad offers from big companies, big conglomerate, hotel companies, but they're giving us horrible offers. So as a function of marketing and thinking outside of the box, and this was back in, 2013, living here in AZ, my dad had gone across the border to get dental work. We were starting to see all of these commercials on TV about medical tourism. I knew a lot of people that were getting their pharmaceuticals from Mexico and bringing them across the border. So being that border state, medical tourism was, was something that was really well known here in Arizona. I'm sure California, Texas kind of experienced the same thing. The rest of the country probably don't hear about it as much. Maybe now. But back then, I was really just trying to market this property. And I said, why don't we go and market this property to medical tourism providers? And in doing so, this group of stem cell scientists came across the pitch of selling this property, and that was my first real introduction to deep stem cell therapy, and it blew my mind. I was like, wow, are you telling me the truth? Can this really accomplish what you're saying? And then, so I had to do a deep dive and some due diligence on this company, and I got to go into their lab, and I saw some of their results, and I saw these amazing testimonials that kind of pulled on my heartstrings a little bit. And over the course of some time, maybe 18 months or so, I ended up transitioning into starting a stem cell company.
Okay. So why Colombia?
A fantastic question that I don't think I cover enough because it's very important. So Colombia, as you indicated already, is, it's got that stigma of like, it might be dangerous, or, it's a third world country. And that has nothing to do with it. It has nothing to do with deregulation. In fact, our FDA equivalent is called INVIMA. They are more strict than the FDA in a lot of cases. It is much easier to open a clinic in the United States than it is in Colombia. So it's not because of deregulation, but the three things that I was looking for is, number one, I was looking for very well-trained, well-respected doctors. And then I was looking for that medical infrastructure. And because Colombia was a war zone back in the 1980s and early 90s, they started having to build all of these major trauma centers and these great hospitals. And then that spawned a lot of great doctors and then more great hospitals. And it was this great medical infrastructure that is top notch, some of the best in the world. And then obviously really good regulation for stem cell therapy. So it's those three reasons.
Okay. Yeah. And great food too.
Yeah. Okay. So if we get, that's just choosing Colombia. The reason I chose Medellin was, for one, it was the last on my list. It was by far the last on my list because of all those reasons that we've already talked about. So I went to Cartagena, I went to Bogota, and I kind of reluctantly went to Medellin. And then the minute that I laid eyes on it, I went, wow, this is magical. It just looks magical. But then the temperature is 75 degrees all year round, basically. So it's like, wow, okay, the temperature's perfect. And then you try the food and you're like, wow, this is clean. It's not compromised by glyphosate and, hormones and all the things that are making our food system pretty difficult right now. It's not compromised by that. So then you eat clean. Yeah. So anyway, it was an easy choice at that point.
I had everything in sight.
Yeah.
And I can tell you, I didn't feel bloated. I was like, okay, this is great.
Yep.
So I was like, okay, I gotta get back down here.
We have patients that come for, major gut issues, Crohn's and colitis, and, and a whole host of other issues. And they can actually eat in a different way, foods that they haven't been able to eat in years in the United States.
Great. And I can see that. So let's get to a foundational question here, because I think there is confusion, and the confusion sometimes comes from how it's marketed. And that question is, what is a stem cell? And the reason I say marketing, because there are clinics that are claiming we have stem cells and they ain't stem cells, right? And so I just wonder if stem cells have gotten this blanket term, like it's a stem cell. Well, that's not the accurate kind of definition of it. So for those listeners who are on the fence about it or new to it, what is a stem cell?
So the stem cell is a cell within our body that is able to divide indefinitely, and it repairs damaged tissue, and it has several mechanisms of action. But the main three that I usually put it into a large bucket is it reduces inflammation, it stimulates repair, and it also modulates your immune system. Those are three major buckets. If you talk to, deeper medical, physicians and some of our scientists, they'll say, shame on you. There's so many other things that they do, but those are the three majors. Right. And part of what you're getting into, I think, in the way that things are marketed is the term stem cell is being used very widely, and for many different indications and also many different sources. So what you're seeing a lot in the United States, which is starting to shift, but you're seeing mostly adipose tissue extraction and also bone marrow. And then there's umbilical cord. And the umbilical cord is where we source our stem cells. What a lot of these other companies are doing is they're also using that same term, quote unquote stem cell, and they're mixing it with a bunch of other stem cells, especially when you're extracting it from bone marrow or adipose tissue. So there's a bunch of other cells in there, hematopoietic cells and all sorts of other kind of a mixed mash of cells that you're also getting injected. We take a different approach where we take the umbilical cord and then we specifically focus on the mesenchymal stem cell or mesenchymal, depending on what part of the world you're in.
Yeah, true.
For me, it's mesenchymal. I don't know why. It's just easier to say, I guess. But we take those and then we discard everything else, and we only focus on the mesenchymal stem cells, and then we culture expand those.
So when you say mesenchymal stem cell, what is that? And again, I'm asking this just because assuming that people don't know. I know the answer to this.
Yeah.
But when you say mesenchymal, is really about what the stem cell can turn into, right? So can you give us a little bit more definition on that?
Yeah, sure. So the acronym is MSC. A lot of the early stage, Dr. Kaplan is the one that found it. So he was at Case Western, a brilliant scientist. He termed the coin MSC, which was mesenchymal stem cell. That is actually switched, and a lot of us in the industry are switching that to medical signaling cell. Really what those stem cells do, and it was first thought that they were able to turn into any cell. And the truth is they're actually signaling your own cells to stimulate a response and turn into other cell lineages. So just over the span of the last, I guess that's the last 20 years, just the mechanism of that action has changed pretty dramatically. But essentially these cells that we're introducing, these new MSCs that we're introducing into our patients, the main mechanism is to signal your own cells to stimulate repair or, for the anti-inflammatory effect or to upregulate or downregulate your immune system.
Okay. So, and this leads to the question, because you mentioned the bone marrow and you mentioned the adipose, because those are called autologous stem cells.
Mm-hmm.
You're getting your own stem cells, right? Mm-hmm. Which, from a perspective of when you think about what's the risk factor of doing stem cells, I mean, if it's your own cells, it's like, well, I know my body's not going to reject it because it's coming from me.
Mm-hmm.
But then when you think about, okay, like even though they are umbilical stem cells, that's the source of it, it's still not you're not your own donor for the cells. How do you comfort people on that? Because I know that's something you got to have this part of the discussion.
Mm-hmm.
Like, hey, just so you know, these are coming from a donor. They're not your stem cells, but we're saying your body should not react to them. How do you have that discussion with the potential kind of patient or client that's coming down there?
Well, 10 years ago when I started BioAccelerator, it was a little bit more difficult because stem cell wasn't as well known and well respected, and we didn't have as many real world cases of excellent results. So now patients are coming in a lot more educated, and it's not as much of a concern, but it is still obviously a concern. So, you just relate it to things like bone marrow transplants or blood transplant or blood infusions, and it's not. There's not a donor rejection issue in this case, because the MSC is one of the only cells that does not have an HLA tail, which is your body's response and how they know that there is something foreign in your body. So there's not a host versus graft issue, but the MSC itself is, it's one of those cells that does not have that tail. So it's able to go into your body as an allogeneic source and not have any immune response reactions.
Okay. So another term people will hear when they start looking into stem cells is a pluripotent stem cell.
Mm-hmm.
They'll hear embryonic stem cell.
Mm-hmm.
Can you just describe what the difference is between an MSC and those two other types of stem cells?
Yeah, sure. So the pluripotent, and actually there's great technology out there where you can actually induce one of these cells to be an induced pluripotent cell. Ours are actually more multipotent than pluripotent. But to get back to maybe the root of the question, and maybe this is where you're going, but it's very important to point out, I think, to your audience, is that we are not using embryonic stem cells. And that is a misnomer that has, been kind of debunked for the last 25 years, but I still hear it a lot. I even hear it in the news. I hear other physicians saying this. And the truth is that this was a valid concern back in the early 2000s. In the early 2000s, when we really started researching mesenchymal stem cells, or stem cells in general, embryonic stem cells, and the use in potential treatment into humans, was that there was unethical sourcing of embryonic stem cells, and we don't do that at all. And really no reputable company does that at this point. And we're talking about horrible things like, getting aborted fetuses and using those stem cells in the treatment of patients. And what we found, or what the industry found, well, that's why I say we, but what the industry found at that point was that there was some concerns with the embryonic stem cell in the way that it continued to proliferate all cells, including potential tumor type cells or cancerous type cells. And that was kind of the thought process. So George Bush did a speech in the early 2000s and kind of put all stops to stem cell therapy, which slowed down the industry a little bit. And he was doing that because of the ethical concerns of the sourcing of embryonic. What that did for the industry is it made us kind of switch in looking into other cells, which is where Dr. Kaplan really started looking at the mesenchymal stem cell. And so that ethical concern is behind us. What we do is we take a healthy baby and a healthy mother that go home and live healthy lives together, when usually that umbilical cord would be donated, or just medical waste. Now it's donated to scientific companies like ours, to where we can now ethically help hundreds or thousands of patients with that one cord.
So that's a good segue there, because a lot of times you look at some of the regenerative clinics here in the States, mm-hmm. where they're offering, and again, you Google stem cell and you'll find these clinics, but they're not, that's where it's an interesting line here, because they're not exactly stem cells, right? They're kind of more like an amniotic fluid. Mm-hmm. Sometimes they'll use sometimes it will be a Wharton Shelley product, but it's not the stem cell. And then there's exosomes, mm-hmm. right? And we'll talk about that, in probably the next question as well.
Okay.
But what's the difference between the stem cells that you guys are doing down in Medellin versus the companies here? They're like, hey, we have stem cells, and it's just like, here's a vial of amniotic fluid with growth factors in it.
Yeah, there's a big difference between what they're calling stem cells and what we call our stem cells. Because our stem cells are pure. They're the most potent and pure stem cell product on the planet. And I say that because we guarantee it. And we can do that because, to my knowledge, we're the only fully vertically integrated clinic in the world. Now, there's some that are close. I'm not saying there's not other great practitioners out there, but we take it very seriously. Having a relationship with the birth parents, knowing their history, and either including or excluding potential donors of the umbilical cord, whereby we even go in and we collect that umbilical cord only through C-section, and then we have control of every other piece of the chain of custody. Whereas, to get to your question, a lot of these other companies, actually all of these other companies, are really just, in my opinion, brokers. They're stem cell brokers. They're brokering one part of the chain of custody, and they have no relationship, in most cases, with the end user, except for the physician that's applying them. And unfortunately, these great physicians that are applying stem cells, trying to do the best for their patients, giving the patients options, whereby typical US based medicine doesn't really allow you to do that in a lot of cases. As we kind of talked about already, that's changing in certain states. But anyways, these great physicians that are applying stem cells that they're purchasing from presumably a good laboratory are in most cases applying very low level cells and I think to your point, not even cells. A lot of times it's just the growth factors and the cells are not viable at all. So patients are still seeing some result. So I'm not saying that they should stop that practice, but if they were educated on it, they would realize that they're actually kind of taking money from their patients and applying a product that they're saying is stem cell when it's not really stem cell. Yeah. And part of that, to get into the laboratory piece, presumably these laboratories are great. Now, these laboratories they're businesses. And, I'm, as we already discussed, I'm a pure business guy, no medical background, no scientific aptitude. And when I look at any business on the planet, especially if you have a product, what you try to do as a business owner or anybody within the business is you try to increase production and lower your cost. And that's just business. So these laboratories are in business to sell stem cells. So they want to increase their production of cells and decrease their cost. And there's many ways that you can do that, especially if you don't have a relationship to the end user. So you can use very inexpensive products to help culture and expand and multiply these cells. And we know that these products can potentially be dangerous, but they're just not the best for results. We also know that if you expand or multiply those cells past a certain passage, meaning like they double once and it's a passage. They double twice, it's a second passage, and 3 and 4 and 5. They could expand those cells to be millions of passages if they really wanted, but we know scientifically that if you don't stop that multiplication process within a certain number of passages, then the cells become less and less effective. And so we're seeing these labs that are increasing their production and decreasing cost, and they're sending these cells to these doctors, and they're not lying because they just sell a certain number of cells. They'll sell you as a physician 100 million cells. But those cells are not viable by the time they get there, and they were in the wrong passage count to really be effective anyways.
Right. So you're not 100% sure on what you're getting.
No.
And what it comes down to.
You're almost 0% sure. That's the problem.
Yeah. And that's unfortunate, especially for the patients themselves that are investing in this, right?
It's not it's not inexpensive.
No, it's not even.
Yeah. Insurance doesn't cover it. It's expensive. So it's a big risk. It's a big barrier.
So the other treatment that we're seeing, and I use them too, is the exosome. Mm-hmm. And I'm very clear with my patients, like this is not a stem cell, and I explain that it's a microvesicle that the stem cells excrete. Mm-hmm. And so, but then sometimes it's hard to describe the difference between the two because it's like, well, which one is better? And I'm like, well, stem cell's better. But again, you're in Arizona, this is what I have for you as an option. So when you're having those conversations, when you're physicians, you're, down in Medellin having that conversation, how are you guys explaining the difference between a stem cell and exosomes?
Yeah, you hit it the nail on the head in the sense that the exosome is an extracellular vesicle that's secreted by the stem cell. The exosome itself is actually remarkable for many indications. We use exosomes also. We use exosomes in combination with stem cells because they're a little bit faster acting for things like orthopedic issues and the inflammatory effect that orthopedic, even just the injections cause. So the exosome, the beauty of the exosome, and the reason that I commend you for using it is because it doesn't have some of those logistical issues with freezing and shipping across, shipping out of a great laboratory into the physician's office. You can keep those exosomes viable. So by the time you're putting it into the patient, it's great. It's a viable product. Mm-hmm. What I've seen so far in the industry, especially here in the US, is that these exosomes they're not pure exosomes. So they kind of have that same stigma or the same issue when, I'd quote unquote use the term stem cell. We're almost able to do that with exosomes, quote unquote exosomes, because really what they're doing, a lot of these laboratories, is they're taking a secretome product that has some exosomes in it in the growth factor culture. And so there are some exosomes there. So they're not lying per se. There's exosomes in that vial. but it's such a small concentration that this is really where we need the FDA to come in and give us more clear guidance on what best practices are. And that's what BioAccelerator has taken a lot of time and energy and effort and certainly capital to invest in the global standard of the way things should be. But back to the exosomes real quick, just to finish the answer, is that these exosomes are also not ultra purified. They don't separate out some of the other culture media and then really focus in on expanding that exosome product and ultra purifying it so that the best possible product is shipped. So that's kind of the big difference that I'm seeing.
Yeah. So if you remember, I did a training with with you guys. This is wow, man. It seems like forever ago last year, and it was on some of the applications that I'm using here with exosomes, right? Mm-hmm. And the way I explained it to them, and this is kind of even with your original background in the restaurant industry, it's like if you said to me like, hey, I want to build a restaurant. I don't know how to build it. Like this is new to me. I want to build it. And to me, if I say, hey, I'm going to give you the exosomes, it's like, okay, how about this, man? I'm going to give you this book. This book is going to have some architectural plans in there. It's going to have some SOPs in there. It's going to have a few recipes in there. And I'm going to give this to you. And it's going to basically tell your workers, the people you have, how to do it. This is basically instructions for the most part, right? Mm-hmm. It's the information in the microvesicle, the messenger RNA, all that stuff that it's going to give to, it's basically allowing that environment around the injury to heal. It puts it in a more healing environment, right? Changes the environment to a better, whether it be decreasing inflammation, getting those growth factors in there, and that's part of the secretome as well. Mm-hmm. Where with a stem cell, it's like, hey, not only am I going to give you the instructions, but I'm going to give you some employees too. I'm going to give you some building blocks. I'm going to give you some SOPs you can use long term. I'm going to set you up with an accountant, with an attorney. I'm setting up everything. You're really just going to plug and play. And the exosome also is like, hey, I'm only going to hang out here for like 2 months. I'm out of here. I got another contract to get to. Where the stem cell is like, hey, this is a little bit longer contract. We're going to make sure you get to the end of, the completion, right? Because the exosomes, while they do decrease inflammation and pain more so on the front end, they're kind of like life in the body is a lot shorter than a stem cell, which is going to continue to work a little bit longer. So for me, when I explain it to people, it's like, hey, I can use these exosomes. They're great. They're going to help you heal. They're going to help you reduce pain. But if you have a really severe injury, more chronic injury, you might want to look more at the stem cell pathway because you need more than just instructions to heal. So that's how I've been explaining it. Is that
I love that. I love that. I'm going to steal that from you.
You should steal that.
Yeah. Yeah, no, I'm glad you got me back to the original part of the question too, with the difference of the stem cells. You're right. The stem cell is the brain of the operation. It's the full and complete plan. But the point that I want to really hit on, to echo your point, is that it takes a little bit longer. The stem cell takes a little bit longer to act. So what we're seeing, and we right now, I think we're the only clinic in the world that has a specific combination of stem cells and exosomes together for some of our treatments, not all. But what we're seeing is that the exosomes have a more immediate effect, especially with the anti-inflammatory and the immediate results. So we're seeing patients that have range of motion and reduced pain in a much quicker way. But then the long-term effect is where the stem cells come in.
Mm-hmm. That's really good. So now to kind of get to the fun part of it, if you will, is what...
This has been fun.
It has been fun. Even more fun. We haven't got to the fun stuff, man. We're just kind of, that's like the appetizer, so to speak here. So now we're getting into more of the main course here. So what are some of the conditions that are seeing the best outcomes with stem cell therapy?
So at BioAccelerator, we treat over 170 conditions, and I would imagine that there's other clinics that treat more, and I don't know that that's better. Quite yet. And the reason I say that is that we're completely evidence-based. As you know, because you visited, we have an innovation center where we have a team of epidemiologists that are constantly just working on either our own internal clinical trials or observational studies, or they're working with other clinicians or other hospitals or universities and research centers, so that we're always at the forefront of what's actually proven through evidence, not just throwing spaghetti at the wall and not just saying that, we know stem cell therapy is safe, so let's try it. And we do that in some cases because, we want to help as many people as possible. But so out of that 170 plus that we treat, I would say that we could put those into 3 major buckets, and this is where we're seeing the best results. And that's with orthopedic issues first. We see fantastic results with orthopedic issues. We specialize in spine and disc treatments. So we have 2 neurosurgeons that have pioneered an interdisc interfacet. They didn't pioneer the technique, but they're really the first to do interdisc interfacet stem cell injections, and they've done more than anybody on the planet at this point. And so we see great results there. We also have a lot of autoimmune disease that we treat, and then we take our techniques a step further than a lot of clinics because of our abilities with the neurosurgeon team, and we treat neurological conditions as well. And so we do that through intrathecal injections so that it passes the blood-brain barrier, and we're seeing some remarkable results in some neural conditions. And what we like to focus on, just kind of as a passion project, is spinal cord injury. And, we have seen, I mean, this is a thing that impresses me as just a business guy. I've seen dozens of incredible results, but I'm thinking of a couple. One, Ryan Curtis is an MMA fighter that was in Conor McGregor's training camp, and he got hurt just in a sparring session. Hurt meaning completely paralyzed. And, his doctor said that he would never walk again for sure. They said he was going to lay in bed for the rest of his life. Then they said, at best, we'll be able to get you in a wheelchair to get you around, but you're going to be paralyzed your whole life. I'm proud to say that he's out running at this point.
Oh, is he running now?
He's running now.
Oh man, that's wild.
I mean,
he was down there.
You met him
there. Yeah.
Okay.
Yeah.
So was this one of his first trips where he was full wheelchair?
He was
walking a little.
A little bit.
Okay.
Getting around the chair, but he was able to kind of start moving around a little bit, with the support braces.
Yeah. And I don't want to say that this is all stem cell.
Right.
Stem cell is just a component of his success. I would say that mindset actually is probably the first part, because what I see a lot with these guys, and I totally can't even put myself in the position to think about these major injuries, but a lot of these guys give up because they're listening to their physician saying they're going to lay in bed all the rest of their life. So they don't have a positive mindset to get out there and do the work that it takes. And the work is physical therapy. And then adding stem cell onto that is kind of like, superpower to try to heal. And his is the best case scenario. Most of our patients are not out running again.
Oh, no, it's amazing. Amazing. Yeah. And just kind of even, I remember his buddy was there who was doing more of the video content stuff, and he kind of showed me some of the old videos from where he started. And it was just amazing to see that. The other thing that you kind of mentioned, the neurological conditions, and one of the things that me, just being an ex-military, is the treatment of TBIs, concussions, and things like that. And then are you guys working with veterans or with a veteran organization to get some of those guys down there?
Yeah. Yeah. So this is, again, another passion project. We invest a lot of effort and money, self-funding, charitable endeavors to treat as many veterans as possible. So we have a program of discounts for any veteran, any family of veteran. We do a lot of work with vets. It's just something that's near and dear to our company's heart. But we also work with many veteran organizations. The Resilience Project is a veteran organization that specifically focuses on several pillars of, whether it's faith or also physical. And the physical part is where we help this organization help veterans get back to better health, but also sometimes it's brain health. So this is, PTSD symptoms, but mostly the PTSD is also sometimes caused or mimicked by multiple concussions, and TBI. I'm not saying that these guys don't have PTSD, but also a lot of times they're misdiagnosed. PTSD is misdiagnosed because it's just tons of concussions. So yeah, we treat, we have a clinical trial that we're kicking off to potentially treat CTE. I say potentially because, a lot of times you don't know until post-mortem, but some of the signs are pretty prevalent early on, and they're the same things that we see in TBI with traumatic brain injury, which we do treat a lot of, and there's a lot of evidence in the world that stem cells work very well for TBI.
Okay, good. So a lot of conditions, right? It's over 170 conditions, and they're the ones that you guys specialize in. But I'm sure, especially because, again, if you look at some of the marketing that's done here in the States, there's a lot of, I don't want to call it overstatement, man, but there's a lot of bold claims.
Yeah.
They're very bold here.
I see people using the term cure.
Yeah, which is like,
crazy.
You see all this, right? And then, of course, the patients come to us. We have to kind of like, hey, I'm hopeful for it. It's a great opportunity here, but you have to go into it that it's not magic.
Yep.
So what are some of the most kind of misunderstood or overstated claims that you guys hear down at BioAccelerator when that person's having that initial kind of consult?
Yeah, we spend a lot of time, unfortunately, clearing up the misinformation that patients are hearing. So by the time patients get to us, they're already somewhat educated because we're not in their local market. They have to travel, and many physicians probably have already told them that going offshore is dangerous, or it's snake oil, or whatever that might be the typical, just initial perception. But my point is that our patients that come to us are usually already educated, so they've already heard from a lot of other stem cell companies or physicians or people pitching stem cell, and so they come to us and they say, "Well, yeah, I'm just doing either a price." Understanding, or what makes you guys different, and they'll tell us what they have heard about their specific condition, and we end up denying them in a lot of cases, and we say, no, whoever told you that there's evidence out there that stem cells are going to help that condition, I'm sorry, but we don't believe that. And so really we end up gaining a lot of patients because of that, because they go, wow, everybody else told me that it was going to cure that condition. I'm glad you guys actually shot me straight. Right. But it's a lot of education and a lot of wasted time, clearing up what other marketing companies are out there making outrageous claims. And it's hurting our industry in general, because the FDA, although I don't agree with them in slowing down this pathway to regulatory compliance, I do agree with them in the sense that there's a lot of unreasonable marketing claims that need to be addressed.
Okay, gotcha. That's a good, man, I feel like you got my segues down, man, because I wasn't going to get into some of the FDA regulations a little bit.
Yep.
And if you're comfortable talking about
it. Of course,
right?
Yeah, let's go.
Because the big question that I think is why can't we do this in the States?
So, without going too far down the conspiratorial rabbit hole, I believe that the FDA are full of, great people that have, at one point put themselves in the position to really do good for our country. And the FDA in general has protected, countless Americans from potential harm. And the FDA is the gold standard around the world. I work in a South American country where our regulatory body is very strict and very updated with the way things should be, but they always look at the FDA to compare. And so the FDA is the gold standard, but the FDA certainly has financial incentives to not push this quickly because their main source of income comes from the private sector, and the private sector is typically pharmaceutical companies or device companies. So, so they're financially motivated to slow this down, and that is what it is. But also because there's misinformation that has been propagated through some of the things that we talked about already, where the embryonic stem cells, people still think that embryonic stem cells are being used and that it's super dangerous and that there's unethical sourcing of these stem cells. So I think it's an educational process, and I think that they have to really look at what's great for the Americans and the American public and what we should have access to. And I'm happy to see that there's specific states out there that are actually taking a harder look at this and saying, you know what, FDA, I think you're wrong on this one. I think we're going to allow our constituents, our population to have access to this, because there is no debate in the scientific community whether or not this is safe and effective for a lot of conditions, not all, but a lot. And so when that debate is really gone, the states are now saying, yeah, why aren't we giving our patients access to this?
Okay. I like it. So, man, I feel like I had a question queued up on like the myths, but I think you got them.
Okay.
You got the sourcing, make sure it's, the ethical versus the unethical. That stem cell therapy here is not the same as what you're getting.
Yeah, all stem cells are not created equal.
You got that. And then that it's unproven, that it's just you kind of hit that point as well, because there's tons of research out there. So you got that.
That's actually, let's highlight that again though, because physicians, one of the main things we see our patients come in into our, let's say our pipeline, our funnel, when they start asking us questions, and they say, well, I talked to my local physician and they said that stem cells are unproven or there's no evidence. And that blows my mind because there's tons of evidence. There's decades of evidence. There's decades of real placebo-controlled double-blind studies that show that stem cells are safe and effective in certain conditions. So for physicians to think that there's no evidence, please, before you say that, go and look for it first and make sure that you're saying something that's accurate, because there's tons of evidence.
There is. So I want to circle back to kind of these three main buckets of therapy, which is the stem cells, the mesenchymal stem cells, the exosomes, and the autologous neuronal cells. And the reason I want to talk about that, because to me, there's a time and a place for everything, and there's a purpose for certain things. But in your opinion, and what you guys are seeing down there with the clinic, is what are the main pros and cons of the three? So let's start with the easy one, with the word Shelley, or the mesenchymal stem cells.
Okay, so I think that'll go directly into the autologous treatment also, because the reason that we chose this pathway is because of research and evidence. Research and evidence shows that these are some of the most potent and pure and effective cells. And really what you're looking for through the sourcing of those cells through bone marrow or adipose tissue is also to get those same cells, those mesenchymal stem cells. But you have to do it in a more invasive way. So to get your fat, you have to, do an incision and get a cannula and suck out a bunch of fat and make this trauma of taking out the fat. Same thing with bone marrow. Right? I think you puncture the iliac crest and suck out a bunch of bone marrow. And so now you're creating this trauma, which is going to need to be healed. And then you're extracting the stem cells to heal another injury. And what we know about stem cells is that they have a mechanism called homing, where if they're working properly, they will go and home to the site of major inflammation. Well, you just created major inflammation through those two incisions, or those two procedures. So, for that fact alone, we didn't choose to go that route. Not saying that those are bad, not saying that they're ineffective, but they're not as effective as taking a pure, day-old, potent and pure mesenchymal stem cell that has not been exposed to your environment. In my case, it would be 49 years of whatever abuse I have been surrounded by. Not even saying, I could be the healthiest person on the planet, which, by the way, I'm not, unfortunately. I drank a bunch in college, and I did stupid stuff all throughout my life. Occasionally, I like eating dessert occasionally, and so. But that means that my environment has not been 100% pristine. That's not the case with the umbilical cord that we harvest on the day of birth, and so those are kind of main factors that made us choose the route that we chose.
Yeah, and I think you hit a big one there. Is just that an older patient, a less healthy patient, those aren't the same quality stem cells you're going to get from that newborn, right? And so it's kind of like, I would not want to take a 72-year-old stem cell to heal an ACL injury, because number one, how effective are they going to be? And then how slow is how slow or how fast the cells are going to divide for you to expand the cell line as well. So I think it's a little bit different with that.
And, and physicians don't typically have the scientific ability to actually get the most out of that extracted adipose tissue or bone marrow, because they're just taking and putting it in a centrifuge.
Yeah, you spin it.
And that's it's a technique, but it's only a small component of a real scientific technique that we would culture expand and really focus in just on the mesenchymal stem cells. Okay. So you get a mishmash of other cells also.
So this one is a good one for, like, say you get an ACL tear, right? You come down there and you take a flight down there, you enjoy Medellin, you do your treatments. And again, you guys do more than just, pop and go home. There's a whole process that, we'll talk about that as we get a little further into it. But how do you, when the patient leaves, because now they're gone, they've left Columbia, and now you want to make sure they're doing well. And with the patient being remote, like, how do you guys measure and track success with these patients that you've seen that have come down there?
Yeah, this one is tough. And I say tough because when patients are seeing good results, for some reason they stop answering the phone. It's a blessing and it's a curse at the same time because, we're dealing typically with very busy people. We deal with a lot of professional athletes and celebrities and, people that are already busy. And unfortunately, that's because it's an expensive treatment. And so these are the people that can afford it. But we do have financing options and, we treat more everyday people like me than we do athletes and celebrities and stuff like that. But the point I'm making is that they're already kind of busy. And then, when they go home and they start seeing results and we're calling them for their follow-up calls, which we have a very regimented follow-up program. This is another thing you should really look for in your stem cell provider is their follow-up and getting real world data from what their cells and their treatments actually produce, which we're able to give. But we have a whole team dedicated just to our follow-up program, our clinical care program, and how we follow them is basically through a set of emails to find scores and scales, depending on the indication. They're all different. So for instance, like an orthopedic would be like a WOMAC scale, right? And other indications where we'll call them and get them on the phone. And but what we really are trying to do is have relationships all around the country with guys like you, where we can send our patients and say, hey, we want the same doctor to do this exact same follow-up, to collect the data, to make sure that we're getting more objective data than just scores and scales.
Yeah, or just subjective. Because again, if they come here, like if you're going for an ACL injury, like it's one thing to give a guy a call or a girl a call and say, hey, I feel better.
Yeah.
Okay, great. It's another.
That was the main objective.
Yeah, which is good. Yeah. But it's another to, for the doctor to do like a strength test. And let's do that and let me, do a drawer test and see, like how much movement I'm getting on the ACL or the PCL.
Mm-hmm.
And it just kind of like, does it hurt when I touch here? Mm-hmm. Oh, that used to hurt really bad and now it doesn't, right? You're able to kind of get more of a hands-on approach. And I think that's really good to do as well because again, and like you said, when people feel better, they don't want to talk to you.
Yeah.
I mean, I guess no news is good news, but you want the data to know if this is working and make sure the protocol is the right way.
We do incentivize. I'm sorry to jump in, but we do incentivize our patients to continue to pick up the phone. So we do have a program whereby we invite them back and have a follow-up treatment after the actual study is over. What we're seeing is like some clinics are doing that and then adding more cells into the same treatment period. So it totally throws off the actual, protocol for collecting data. But my point is that we incentivize people to do it and we encourage people to do it. So if you end up coming to BioAccelerator and you want some free goodies at the end, please pick up the phone and get in our program.
So another great segue. So let's just say someone's listening and they're like, hey, this sounds great. I want to know more about this. I want to go to Columbia and get some of these stem cells because I got some injuries or some pain or some conditions that are just not getting better with traditional medicine. So let's talk about the process. So where do you start?
Well, a lot of times we like to start with guys like you. We like you to do initial assessments first, and that would be best for us. But a lot of times our patients are finding us because they've already started doing education on stem cells and they want the best. Mm-hmm. They don't want to have, the guesswork of not understanding, what their physician is applying, and they want a guarantee for potency, purity, and viability. That's what we can guarantee. Almost nobody does that. And so my point is that people that are already doing research and they want the best. So they find us online typically. And from there, we do a quick discovery call just to make sure that they're actual candidates, because as you mentioned earlier, there's a lot of misinformation out there. So we try to clear that up right away. We get a lot of people that say, my clinic in Tampa or wherever, Scottsdale, wherever, some doc told me that stem cells are going to be great for my injury. And we say, okay, what injury is it? And then we go, we're not going to treat that. I'm sorry, that's just not right. But so that initial discovery call can be as fast or slow as you need it to be. If you have 1,000 questions, we'll answer 1,000 questions. But we want to make sure that you're a true candidate. And then from there, the most important thing is that we schedule a physician's consultation with you and a physician to go over your medical records or your images or, your pain points. And, just like any other doctor's office, we have a little medical questionnaire that you have to fill out. So it's pretty simple, all telemedicine up front. The real heavy lifting comes, behind the scenes where our our concierge team is going to work for you. We're collecting medical records for you. We're gathering all the information that you need. We're working with our team of specialists to make sure that we have the correct diagnosis. And from there, we deliver to you a personalized protocol that is specifically tailored for you, your condition, what you're trying to achieve, what we believe would be a reasonable outcome and expectation. And then you decide whether or not it's us that you go with, or you keep looking. Okay. If you decide to go with us, then it's a quick 3-hour flight from Miami, and we take care of everything. Long before you get there, we have a nutritionist that you have a consultation with, and there's a little bit more setup. Sometimes, we might recommend peptides, in which case they're going to go to you. And there's other, specialists that you might be involved with depending on what you're suffering from. If it's just an orthopedic issue, typically, there's not a lot, other than maybe physical therapy that we're prescribing. But the point is, once you get to us in Medellin, it's all white glove service. We pick you up from the airport. We're in this beautiful medical tourism campus, I call it. But really, we're in this beautiful mall that's like a 5-star mall. It's better than anything, or as good as anything you see in the United States. And your hotel is connected to the mall, which is connected to our medical tower. So if you're not really that adventurous, you're in the most protected place with the beautiful restaurants and amenities and everything that you would need. You never have to leave the roof when you're there. But if you are adventurous, we'll also help you go out on some tours and see the city and have it be more of a wellness vacation. Okay. But you're with us we like it to be 5 days. Mm-hmm. We do a lot of 3-day protocols, and then we have some 1-day protocols. So it depends on what you're being treated for. Yeah. We have a lot of professional athletes that are injured in the middle of a season. They come in and out in a day. Right. We have some indications where we can, we might need to get some imaging, so we can get you in and out in 3 days. And then the 5-day protocol is really where we add on the biggest part of the value for some of our alternative therapies that are supportive to stem cell. So we're going to go into hyperbaric chambers, or maybe cryotherapy or ozone therapy, and a whole host of other supportive therapies throughout the week.
Okay. So one thing that I recall from my visit there is, what did I do? I did IVs.
Okay.
Right.
Mm-hmm.
But it ended up being 2 days, mm-hmm. because, they go off of maybe weight, I'm assuming.
Yeah.
It's a big one, so it goes off weight. Yep. And they're like, hey, based on your weight, they made me feel fat, man. Based on your weight, we need 2 days here. We can't do it all in 1 day. Oh my God, you need 2 days here, right? I'm like, fine.
If the camera angle's wide enough, you'll see he's jacked. It's the muscle. It's not.
Oh my God, we need 3 days here. This guy's out of control. And so talk me through that, especially for, someone who's not familiar with stem cells and all that. Especially if you're doing a larger amount of cells, mm-hmm. why would that have to be over 2 days versus just give it all to me at once? Or if I want to do a knee and an IV and my shoulder, why can't I do it all in 1 day?
Yeah, there's definitely diminishing returns in some indications, and sometimes more is not better. And this is something that a lot of other providers don't understand quite yet, and it's because they don't really actually look at a lot of the research. In some cases, more, especially with autoimmune disease, more is actually not better. Sometimes you actually see worse outcomes with the more cells that you give. There's a specific dose that you should give. But back to your question, one of the things that we see in the industry a lot is guys are going into a clinic and getting, like 200 million stem cells IV in one sitting. And that's dangerous. Stem cells, although they're being marketed as almost no danger, it's still a medical procedure. And we're dealing with people that have very serious conditions and health histories that dictate that, you have to take this very seriously. So we look at global evidence, and, and the evidence shows that you shouldn't have, a specific number of cells depending on, who you are, what your health condition is, and what kind of lifestyle you live. But mostly it has to do with the health condition, and also just simplistically body weight versus how many cells to give you. So we split up our large doses, especially if you're getting other doses at the same time. If you're getting a knee and a shoulder and a hip, and then also an IV, it's not beneficial to your immune system to load you up with a big dose IV.
Okay, makes sense. So you might be there a few days. The more you got going on, just kind of settle in, plan on 5 days.
Yeah.
Great place. If you're going to spend 5 days somewhere, I think I can do that.
It's paradise.
It is not bad at all, man. It is not bad.
It's a little secret. I still, I'm kind of torn because as a somebody that has a business there, and we want people to know how beautiful it is and come and visit, but as somebody that likes to live there, and I kind of want to keep it a secret. Like,
yeah, man. That but that traffic will send you home, man.
Yeah. It's
traffic will. Like, I think I'm gonna head back home now for a little bit here. And I remember, like, at certain days, your license plate ends in a certain number or letter. You can't drive certain days.
Pico placa. Yeah.
So, it still doesn't. It didn't.
No, traffic's pretty bad.
Just imagine if everyone was on the road right now, man. Yeah. So it just wasn't. It wasn't built for. It's not like they don't have like 5-lane highways and 3-lane, on each side of the road kind of thing. There's no Camelback Road. No. For those who've been to Phoenix before, there's no street going through the city with 4 or 5 lanes.
Yeah, but we also are blessed here in the sense that we designed it to be a big grid. I mean, it's just the easiest place to get around. There, they just bolted on streets as they needed them. So they go in circles and S shapes and they're all over the place.
There's a road's right here. Just shut up and drive.
Yeah.
That's how we kind of did it. We built this to a mountain.
And if you miss a turn, a lot of them are one way. So if you miss a turn, you're like, oh, I have to go like 4 miles that way just to catch.
That's it.
Go back.
That is it. So that is pretty much the only downside of it that I can tell you.
Yeah.
So just before we close it out, man, like, what role do you see stem cells playing in the future of not only regenerative medicine, but longevity medicine as well?
Well, this is, part of my moonshot goal at founding the company 10 years ago. I really want to see this as preventative medicine, and I want to see it prescribed in a different way than we're able to do it now. I think that, thank goodness Bobby Kennedy is pushing for a reform. I'm not saying that I agree with everything that he's doing, but he's at least saying, like, let's take a hard look at the way that our system has been designed, and let's take a hard look at it because of the evidence that's out there. We spend more than all countries, but like many of them put together on medicine, and we do not have the healthiest population by a long shot. So if you just look at that kind of data, you go, okay, maybe there's room to fix. Maybe there's some things we could adjust. And the point that I'm making, to get back to your question, is that I would like to see regenerative medicine prescribed before where it is now. And right now it's being used as worst case last, after you've tried these other modalities. And, and a lot of times it's before, or it's prescribed after surgery, after you've been prescribed pharmaceuticals, when in reality, it should be tried first. And it might not work. It's medicine. There's non-responders. It doesn't work for everybody, and you might not be the right candidate. And maybe you do have to go get surgery. And by the way, we tell a lot of people that have gotten information from other clinics, and they said, oh yeah, XYZ clinic said they would treat me, and I'm just price shopping. Okay, well, we don't agree. We think you need surgery, actually. So I'm sorry, we're actually not going to treat you because you need surgery first.
Yeah, this is the complete tear case.
Yeah.
Like, it is a complete, there's
nothing. Stem cells are not going to put it together.
No. That's a conversation. It's a hard conversation because people they don't want to do surgery. And I get it. I totally get it. But like, I'm not going to inject an exosome in there or send you to Medellin and say, hey, I can't do it, because it's just, will it help you with pain for a little bit? Probably. Will it help it heal? No. Then now there's going to be frustration, right? And it's not an ethical thing to do if it's a complete tear.
Yeah.
You can't do it, and not to cut you off, man. I get that. I can see it because do you see so many of the benefits, and maybe it's not a malicious thing. It's like, look, this is what we got as a potential option. But I think it's fair to just say, hey man, look, I know this isn't what you want to hear. This is where we are, you know? And I think that's an important and an open and transparent conversation to have with someone, because I don't want to be the person that's telling you to give you hope and it's false hope.
Yeah.
I can't do it.
Yeah. And that's a good point, because a lot of other cell therapy providers that, again, they're brokers, they're actually not experts in stem cell. They're just buying stem cells from somewhere and they're injecting them because they heard that it was safe and effective. And, I say good on them for trying on some level. But they're just not the experts. And so they're selling false hope a lot of times. And that's a real detriment to my industry, our industry, and it's something that I'd like to see cleaned up. And this is kind of why we have been, given the term of global standard, because we really have put together the standard of how it should be administered.
Right. Okay. Home turn, man.
All right.
We're on the home stretch here.
All right. Good stuff.
For listeners out there who their curiosity has been piqued, but they're hesitant about it, what advice would you give them for starting the journey of stem cell, either talking to their practitioner or learning more? What's a good starting point for someone who's interested in this?
I really hope we can get to a place where I can answer this question simply by saying, go talk to your practitioner.
Right. Yeah.
Right now, that's actually not your best option in most cases. Now, my whole company is full of great doctors. I love great doctors. You're a great doctor. But as we talked about before, you're also progressive because you opened up your mind and you said, yeah, I'll go to Medigene and learn and see what it's all about. A lot of physicians still, think that it's at best the future of medicine. What they don't know is the future is happening right now. It's already been happening for the last decade. We've been helping thousands and thousands of people, and we can prove it through evidence. And so I would say that first you should actually get on that Google machine or AI machine or whatever you call it. I'm sounding like an old person right now. It's kind of a joke, but go and search out information yourself, and then ask some physicians, not just one. Ask multiple, because you're going to get a variety of different answers. I promise you. And I hope that one day we get to a place where I can just say, go ask your doctor, because they'll give you the best information. Right now, they don't know. They're not the experts. Most MDs didn't have much of training, if any, in microbiology or anything related to stem cell. Now, I think there's probably a couple of classes, but I put it in the same bucket as like nutrition. Right? Most physicians don't get well trained on nutrition, even though it's a major component of human health and longevity and the outcomes even of injuries, certainly of disease. So I would say go out there. You're going to have to do a lot of research on your own. If you're interested in getting very transparent, legitimate answers, whether you choose us or not, look at BioAccelerator. We have a lot of education on YouTube. We have every channel, but we also do something that other practitioners don't do. We give you free consultations, so you can come in and you can learn as much as you want. And if you decide to go on your merry way, that's okay. That's the service that we're providing to the public. So
awesome.
Shameless kind of plug there, but
no, it's great. It's great. No, we have brochures at the front desk with the QR code, and I'm giving them the patients and like, hey, here you go if you want to learn more.
Yeah,
and I have the initial conversation, and they kind of make their own decision. So, if you could go back in time, and what year did you guys start BioAccelerator?
I founded the company in 2015, so we're celebrating
10 years.
Yeah.
So if you can go back to 10 years ago, where you signed that first piece of paper, like we're starting this company, what piece of advice would you give yourself based on what you've learned in the last 10 years?
So, first off, I would say, Eric, this is not going to be easy.
Yeah.
And I would also say, take off the rose-colored glasses, because when I went into this, I thought, and as a business guy, I thought, wow, I'm going to be able to help our community. And this is something I haven't focused my business endeavors on before. And so that was a main motivator. That has all been proven to be true. It's the blessing of my life. I get patients every day. I get great physicians like you that are complimentary to what we're doing, or you're saying, hey, I saw a patient that actually had great results. Thank you for that. Or, hey, I learned something from you. But it's the patients that contact me and pretend that I have something to do with their outcomes, which, our physicians have all the glory in that respect. But it's been the blessing of my life to really help our community. So that part came true. But what I was saying, take off the rose-colored glasses, is I thought, wow, I'm going to invest my time and my business acumen and my own money and energy into starting this to help the American public, and everybody's going to love that. This is what I thought. And everybody's going to rally behind that, and it's going to be easy. All you have to do is show them the data that shows that we're going to help Americans. And for sure, the regulation is going to change. It might not be legal back in 2015, but it could only take a couple years to get this, approved by at least our local government, or then the FDA. And so that's a route I went at first. I thought, okay, we'll have to be offshore for a little while, but then we'll come back on shore quickly. And it's now been a decade, and we're just barely seeing that.
Yeah.
So I'd say, Eric, just because it's great, don't think that a lot of people are going to get behind you.
Okay. Well, hey,
it's the exact opposite. Actually, people are against us.
Yeah, I know, but you're still here, man. And 10 years later, still growing. So finally, where can our listeners learn more about you and BioAccelerator?
Well, first, I would say that you're a great resource. Obviously, if they're in your ecosphere or in your audience, that you're a great resource. And but specifically for us, it's bioaccelerator.com, BioXCellerator. So it's spelled a little bit different than you might assume. But our our information on our YouTube channel is actually a good resource to see real outcomes, real patient results. You can see follow-up imaging. That's something we didn't talk about, actually. We try to get as many follow-up images as possible. Also very difficult, but we have them. So that's a good resource to see some of our actual patients and their results. Otherwise, every social channel is great, but the best resource is to contact us somehow through our website. If you want to use a chatbot, fine. If you want to call us directly, fine. If you just want to email us, fine. But get in contact with our free consultation process. This is where we will give you as much education as you'll need to make whatever decision you make, whether it's us or somebody else.
Gotcha. And I'm going to have all that information in the show notes too.
Cool.
The website. There was like a concierge consultation number I found on the website. It's like an 888 number.
Yep.
And then obviously the social media channels as well. And then you guys, the treatment center's in Columbia, but you guys have a corporate headquarters here in Scottsdale, right?
Yep. Yeah. And if you want to come visit us in person in Scottsdale, that's great. We don't have a lot of walk-ins in Columbia. You have to schedule that, but we're happy to have you at the clinic also if you happen to be in Medellin.
Okay. Awesome. All right, man. Well, this has been fun.
Yeah.
It's a long time coming, man. That was last May.
Yeah.
Down there. So, you've been traveling, doing all your thing, and I've been kind of busy here, but I'm glad we made time for this.
Yeah.
I appreciate it. And
I appreciate the invite. I appreciate your advocacy, your support of the stem cell industry, and that includes other extracellular vesicles like exosomes and the great work that you do. And thank you for getting our patients all dialed in on peptides and all the other things that aren't our expertise and they're yours.
So, man, that's what I'm here for, man. I'm here to learn and here to help.
Yeah.
I'm here to help. That's my mission in life, here to help. So, all right, man. Well, this has been fun. Until next time, I'm going to let you get out of here and you got to go save the world, man. So, all right, everyone, this has been another episode of the Dr. Greg Jones Optimization Academy. For more information on today's episode, please check out the show notes. Please check out BioAccelerator. Please like, subscribe, and follow our channel. And until next time, let's keep healthy and let's keep optimizing.